Hi, everybody. How wonderful to be able to speak with you this morning. And first of all, I actually want to start off by congratulating ADHD Europe because you are doing sterling work in sharing information, scientific and accurate information about ADHD in general. You're supporting people living with ADHD, you're supporting their families. And particularly this morning, we're looking at 51% of the population who are often neglected, and those are women and girls with ADHD. So it's my pleasure to talk to you today about ADHD in girls and women. And I'm going to be sharing my slides with you. Don't forget that there will be time for questions at the end of the session. So you can put your questions into the chat onto YouTube or Facebook, and they will appear on the screen for everybody to see. So I'm going to be talking to you this morning about some work that we've been doing on the influence of hormones on ADHD. It's quite new work. For some decades, in fact, there's been a suspicion that women have a different experience of ADHD, their symptoms are different, the prevalence is different, and researchers have been trying to understand why that is. The world of women with ADHD, as you can see from this image, is creative, it's chaotic, it's often misunderstood. And I hope with my talk today, I'm going to be able to shed more light on the role that hormones play. And I'm not going to say female hormones because in fact we share a lot of hormones with men. So, but hormones do seem to have a role that is different in women and girls with ADHD compared to boys and men. Okay, let me start off with my conflicts of interest. I want to mention to you that together with my colleague Sandra Coy, we've launched an online video power bank. So it's called the ADHD Power Bank. That's the website. You can subscribe, and there are 30 different short videos that are easy to understand, that are scientifically up to date and accurate. They're not more than about 15 minutes on many aspects of ADHD, bringing you cutting-edge scientific information. And of course, we're going to be updating the videos all along continuously. They're available in French and in English. So have a look at the ADHD Power Bank. In addition, I work for the Diva Foundation, and our good news is that we have a PhD student who is currently trying to examine how good the Diva interview is to diagnose ADHD in both women and men. And then we're going to be adjusting the Diva with extra questions around hormones to try and make it even more accurate, to ensure that women with ADHD have a good chance of being accurately diagnosed as soon as possible. So today we're going to talk about really whether there are more girls or boys with ADHD, and then I'm going to spend a lot of time talking about reproductive hormones in ADHD and mood. And in addition, that word reproductive hormones, thinking of estrogen, progesterone, those hormones actually do so much more than reproduction. So by the end of this talk, you'll understand that in fact those hormones are involved in many brain functions, and they're particularly relevant in ADHD in women and in girls. So first of all, do you think there are more girls or boys with ADHD? And for many years, ADHD was considered a male condition. In fact, the diagnostic manuals describe it as such. And parents, when interviewed, are found in studies to find the DSM-4 criteria as descriptive of boy children and not girl children. In fact, the research field has neglected ADHD in girls, and therefore much more is known about how it presents in boys. And this is something we're trying to remedy, we're trying to improve. Now here's a picture from the Netherlands from the 17th century. I think it's one of the earliest depictions of ADHD. It's called the village classroom. And you can see here at the back, I hope you can see my my mouse, but basically there's two boys who are fighting in the back of the classroom. There's one hyperactive boy who's standing and giggling on the table and not paying any attention to the work that should be done. The teacher is filing his nails. There's one little boy on the right giving a pair of glasses to an owl who was considered at that time not a symbol of wisdom, but in fact owls were considered a symbol of stupidity. So giving an owl a pair of glasses was a complete waste of time. There are a few children who are working in the foreground, but really the key kids, and that's behind me. Sorry, I'm going to go back one slide. That's behind the picture of me. Those are two little girls who are sitting quietly and doing their work. Okay, I see a question on the screen. Is it going to be possible to replay this as a live event? I think that's something that you're going to have to follow up with Chantal, because Chantal is the one who's managing this from ADHD Europe. Okay, so in terms of more girls or boys with ADHD, the answer to that question is really it depends where you look. If you look in population studies, in community studies, then yes, there are more boys than girls, but it's about 3 to 1. If you look at the more severe cases in clinical studies, then it goes up to 10 to 1 times more boys than girls. So yes, in many European countries, it's been shown that more boys than girls are diagnosed. That means two things. It means that girls are underdiagnosed. It means that girls are often missed. It may also mean that, in fact, there is less ADHD in girls, although they do catch up in adulthood. Let's shift now to hormonal changes, mood, and ADHD. So I'm not sure whether people in the audience have any changes they themselves experience related to hormones. And I'm thinking here of your menstrual cycle. Do you notice that your ADHD gets different at different points of your menstrual cycle? I'm thinking also here of your mood, your depression, if possibly anxiety and depressive symptoms, of those fluctuating in response to hormones, perhaps premenstrually, perhaps after you've given birth, and for women who are older, perhaps in the time around the menopause, the perimenopause, the years leading up to the menopause and the years thereafter. So the first question I'd like to ask you to consider is, what is the developmental trajectory of ADHD? Now, luckily, we have a lot of information about this by excellent researchers. For example, Barbara Franklin's group has shown different patterns, typically persistent ADHD, which is a sort of line more or less like this across the screen. Then there's ADHD that is present and then seems to remit in adulthood. So that's classical remitting. Then under the threshold of symptoms, there's sub-threshold ADHD. It's unrecognized in childhood. People who have a brain injury can then suddenly develop ADHD symptoms at the age of 24. And then, there are different ways. But one thing that all of these studies miss is what you see here, the cycling. We see that a lot in women, and I want to bring that home to you. ADHD in women is a cyclical condition for many, many women. It doesn't stay constant. The symptoms fluctuate in accordance to waxing and waning of ADHD, of reproductive hormones. So here's someone saying there was a significant increase in symptoms prior to the menstrual cycle, and I suffered terribly with perimenopause, and hormone replacement therapy has been extremely helpful. Lisa, you're right. That's exactly what we have found, in fact. We found that many women with ADHD have more chance of having premenstrual dysphoric disorder or a severe form of PMS. And those same women are more likely to develop perimenopausal symptoms of low mood and physical symptoms associated with the perimenopause, like hot flushes. Okay, so the two questions we asked are hormone-related mood disorders more common in women with ADHD? And then, is ADHD itself influenced by hormonal fluctuations? I want to mention that this research is in its infancy. We've got a lot of catching up to do, but we've begun in The Hague at PsyQ in our clinical and research center. So depression is a real issue for women with ADHD and women in general. Women have twice the prevalence of depression compared to men. And if you look at seasonal depression and particularly winter depression, it's 5 times higher in women. And when women with ADHD get depressed, it's often more serious, it's more frequent, but there's very little research, sadly, that has been done. And that's what we are trying to rectify. So it seems that there's certain periods in a woman's life and a teenage girl's life where she is vulnerable for depression. And it seems that these periods are when estrogen levels are low. Don't panic, because I'm going to explain this to you in some detail. But the 3 periods in a woman's life where estrogen levels plummet are just before she has a menstrual period, after she's had a baby, and around the time that she's moving towards menopause, which is from the 40s moving on, the age of 40 moving on. The average age of menopause in women is 51, but that depends on many factors, ethnic group and poverty status, but on average it's 51. Now here, as I promised you in more detail, is the menstrual cycle. So you can see it's divided into 3 parts. The first 2 weeks are called the follicular phase, and that is when this little follicle that becomes an egg is developing. So in the first 2 weeks of your cycle, inside a little pouch or vesicle, the follicle grows and grows and grows. And on day 14, on average, after 2 weeks, you ovulate. After that, if there is a sperm that meets with an egg, then a fetus develops. If that egg is not fertilized, then it becomes what's called a yellow body or a corpus luteum that has an important job to produce hormones, particularly progesterone, and then it just disappears and becomes a white body or a corpus albicans. So that's how we have a menstrual cycle on average. Now what you can see is in the first 2 weeks of the cycle, you have a slow building up of the lining of the womb or the uterus. In the second 2 weeks of the cycle, which we call the luteal phase, from day 14 ovulation till the end of the cycle, you can see that the endometrium or uterine lining is rich with blood vessels and getting thicker, so that a little fetus can nestle in there and grow. If there is no fertilization, then at about 28 days, this endometrial lining breaks off, it sloughs off, and it is released as menstrual blood. And if we look at what happens to the hormones, we see in yellow that in the first 2 weeks of the cycle in the follicular phase, estrogen or estradiol predominates, so it's quite high, and then just before and around ovulation, it drops. Now that means that some women, just before they ovulate, can have some mood symptoms actually. They can feel more grumpy, irritable, sad. Again, in the second half of the cycle, estrogen rises and continues. And then after menstruation starts, estrogen and progesterone levels are very low. For progesterone, you can see that it predominates in the luteal phase or the second phase of the cycle. But again, both progesterone and estrogen are low during menstruation. Okay, so I want to talk to you a little bit about the so-called premenstrual syndrome that I already mentioned to you. You can see here a tampon. You can see there's a major party happening on the top of the tampon, but that is not true for many women with ADHD. Premenstrually, they in fact have a really hard time, and that lasts into menstruation as well. So what is this premenstrual syndrome? We hear the term bandied about a lot. It's about a week before your period. You get physical symptoms like sensitive breasts and headaches and mood swings. Can be normal and just not cause major problems. Some of those symptoms are physical, some of them are psychological, particularly irritability and depression. But key to this syndrome is that shortly after your period starts, the symptoms disappear. They can be mild, as I said, but they can in fact become disabling. And if they're disabling, we call it something else. We call it premenstrual dysphoric disorder. So in this image, you see the vagina, you see the uterus, you see the fallopian tubes, and you see these two little almond-shaped organs, which are the ovaries. So for women who have the severe form of PMS, which is called PMDD, they have really dramatic psychological symptoms with deep depression, anxiety, irritability, and significant mood swings as well. So they just don't recognize themselves. It affects about 1 to 6% of women. They lose control of their emotions, but on top of that, they feel foggy and they don't focus well. They don't concentrate well. And in fact, for women with ADHD, this is even worse because they've got an underlying problem with focus and concentration if they are not medicated. What is important is it can't be constant that you have these symptoms. You have to have at least 1 week in the month where you don't have any symptoms. And of course, being a psychiatric diagnosis, it's got to have a significant negative impact on your life, in your work, on your relationships, on your leisure time. So is it useful then to measure hormone levels in the blood? And in fact, the answer is no. Blood tests don't work. It seems that the blood levels of these hormones are similar in women with and without PMDD. The difference is that women with PMDD seem to be more vulnerable or more sensitive to fluctuations in the hormones. And they also get more cognitive or thinking problems premenstrually. Now, we studied women in our ADHD clinic. And this is a paper by Dora et al. And we've believed then that hormonal changes play a negative role during the menstrual cycle. And this is not just out the blue. I mean, it's partly based on what women were telling us in our clinic, and it's partly based on the little research that had been done before then. Low estrogen was associated with more impulsivity in one study, and low estrogen was also related to less dopamine neurotransmission. And I'm sure all of you know that dopamine is critically important in ADHD. So coming back to the cycle, this part of the cycle premenstrually, when both estrogen and progesterone drop just before the menstruation, is important because estrogen promotes the activity of dopamine neurotransmission. And when estrogen drops, you've got less estrogen, so less concentration and focus, on top of a pre-existing problem with dopamine in women with ADHD, so even less focus and concentration. So these symptoms come back every month. So it's not like you have them once off and not for a year. They come back regularly. Women with ADHD already have low dopamine. On top of that, at certain moments, they have low estrogen. And for some of them, it's a disabling condition. So the question we asked is, are these PMDD symptoms more common in women with ADHD? Okay. So we studied 209. Okay, here we have someone saying, I definitely feel a difference in symptoms and effectiveness of medication during my menstrual cycle. I also have polycystic ovarian syndrome, which seems to influence the brain. But unfortunately, research is lacking. Coco, you're right. You've actually preempted me here. We did find that women describe less effectiveness in their ADHD menstruation premenstrually, and in fact we did a study about that I'll show you a little bit later in my slides. You're correct also that there's some research that PCOS or polycystic ovarian syndrome has a higher prevalence in women with ADHD, and they seem to have worse symptoms. Thanks, Coco. Okay, but coming back to the study, so we had 209 consecutive women with ADHD, and we looked at increased prevalence of symptoms of premenstrual dysphoric disorder, postpartum depressive episodes, and perimenopause. And you can see that these women were very wide-ranging in age, between 18 to 71 years. And what we found is that, in fact, premenstrual dysphoric disorder was more common in ADHD. So having this dip in mood, irritability, brain fog before your period was almost twice as common in the women with ADHD compared to the general population, where it's about 29%. So yes, that's a very scary and horrible time for women with ADHD. So these women on our clinic were describing that their symptoms were cycling, as I mentioned. They weren't just flat. Their mood got worse, their ADHD got worse, and as Coco said, their ADHD medication dosage that seemed to have worked really well for the first 2 weeks of the cycle seemed then to be ineffective. So what we found is that some women, without even speaking to us, increased the dosage. So we thought, yeah, this is important. What is happening during this danger week for the women? Well, they had mood swings, they had poor self-esteem because they didn't recognize themselves anymore. They were acting out of character. They could be so low that they became suicidal. They were anxious. They reported more sleep problems, which already we know are very common in women with ADHD. They had binge eating. It's just unrestrained eating of carbohydrates. They had conflict in their relationship, and they were increasingly impulsive. But then they'd feel terrible shame and embarrassment at their actions and a regret at this loss of control that they didn't seem to be able to manage. So these women with ADHD reported less concentration. So now we're moving across to the more cognitive, brain-related symptoms and brain fog. They also said, look, we're less productive. Now, research has shown that, in fact, women do have difficulty concentrating and impaired productivity premenstrually. And we looked at some women in our clinic and we researched their particular symptoms in some detail. The fact that they were saying my psychostimulant doesn't work is in fact supported by research, because psychostimulants are less effective, and this relates to dexamphetamine, but it might well be true for others because they work in a similar way. They're less effective during the luteal phase. So what the women were saying had in fact been supported by previous research. So this is a paper that my colleague Maxime de Jong and I published at the end of last year. It was a case study of 9 consecutive cases in our clinic of women who had PMDD symptoms and reported that their medication was not working premenstrually. And what we did is we increased the dose of their psychostimulant in the week before they menstruated. And in addition to that, we monitored them closely afterwards so that we could report and publish what they said. Okay, now I believe I've got to go to my second part of the presentation. So I'm going to ask Chantal, please, to put that on the screen. Thank you so much. Okay, so I've mentioned to you that these women were struggling with worse ADHD symptoms and worse depressive. Okay, I saw a question on the screen about birth control pills. Can they help women or do they make them worse? And that's a very interesting question. In fact, both can occur. One of the treatments for PMDD is an oral contraceptive, low-dose oral contraceptive without a stop week. So continuous oral contraceptives, and that stabilizes the menstrual period. Of course, you have some fluctuations, but they're not as dramatic as without medication. And then you don't bleed. There's no problem with that. It's not as if your uterus accumulates more and more and more blood. It just stays at a low level. The lining of your uterus stays at a low level continuously, and it seems to have an effect on the medical and the mood and the ADHD symptoms. But then there's also some research that some women with ADHD have a bad time on oral contraceptives, and in fact their mood and their physical symptoms gets worse. So both are true. I'm going to get onto the treatment of PMDD a bit later in my talk. Okay, so in our research study we looked at 9 consecutive women who had ADHD and many comorbid or simultaneous conditions. Now, they were complex women. On average, they had 3 to 4 coexisting conditions, and 3 of them were already on an SSRI, a serotonergic antidepressant, and that is the second treatment of PMDD, is giving women an SSRI. Let's have a look at the question that was just posted. I don't know whether you can call it up. Okay, sorry, it wasn't a question. It was just feel free to read more about PMDD. So ADHD Europe has got info online. Okay, so what were these comorbid diagnoses? What did the women have? I'm sorry, when I moved my slides over to this StreamYard system, unfortunately, the layout got a little bit changed. So you're going to have to put on your magnifying glasses here. But the coexisting diagnoses were ADD, so not all of them had ADHD, some of them had ADD, and 6 of the 9 had a diagnosis of PMDD. But they also had generalized anxiety, autism, delayed sleep phase, very, very common in people with ADHD, up to 80% of that, alcohol use, panic disorder, depression, and restless legs syndrome, which interferes with sleep quality. So they had 2 different sleep disorders. So what did we do? We increased their dosage in the premenstrual week, and we examined what the effect of this was and whether they developed any adverse effects, if they had any side effects as a result of increasing the dose. Now, in our group, the age was 24 to 48 years. Okay, let's see that comment again. Yeah, that's what, just a summary of the different in big type, different of the different coexisting diagnoses. So we work in a sort of highly specialized adult ADHD clinic. As I said to you, we don't have simple cases with one ADHD diagnosis and nothing else. Most of our patients have several diagnoses, and in fact that is true in general for adult ADHD. So adults with ADHD will have many separate diagnoses, and one needs to address all of them in order to correctly and successfully treat the ADHD. So here's an example of how we increase the dose. We increase the dose in that premenstrual phase by 30 to 50%. So for example, one woman was on lisdexamfetamine, or known as Elvance, and she got a 30% increase. She went up to 40. Another woman was on 50 milligrams, she went up to 70. One woman was on 70 and she went up to 90. And another woman was on 70 and she went up to 100. We also used, there was one woman who was on another psychostimulant, that was methylphenidate extended release. Her dose also increased to 108. Then we had yet another type of psychostimulant, dexmethylphenidate, which is also known in the US as Focalin, might not in fact be available in several European countries, but we have the fortune to have it available in the Netherlands, so we increased that by 30%. And then one person was on the short-acting dexamphetamine, and 20 milligrams went up to 30. Okay, so what happened after we increased the dose? Well, all the women described improvement in their ADHD symptoms, specifically their inattention or lack of focus got better, they were less irritable, their energy levels were better. Some of them even said that my physical symptoms like breast tenderness, swelling, bloatedness, that also got better. Some women said, you know, I can actually manage my physical symptoms better with this dose increase. I can deal with them better. All of them experienced an improvement in mood, and this was with an increase in psychostimulant. They had minimal adverse events, so there were no major side effects with this dose increase. And all women, all of the 9, chose to continue. Now, we want to follow this up with a double-blind, randomized, placebo-controlled trial, because this is a case study. So there are, of course, some strengths and limitations. There was a very small number of patients, only 9. There was no control group. They had a lot of comorbidities, but this, again, reflects what we see in practice. It might be difficult to expect women with ADHD to track their cycles. because, yeah, I mean, it's hard to plan and to organize when you have adult ADHD. On the other hand, fortunately, there's several apps available like Maya and Flow, and these help you keep track of your own menstrual cycles, so I would recommend them to you. What happens if a woman has irregular cycles like PCOS? We heard that already, right? How do you know when you're just about to have your period? If 1 month it's like 21 days and the next month it's 34 days, of course it's difficult to know when you're premenstrual. So yeah, that is difficult for women, and we acknowledge that. We need to address these problems in future research. Now, this is important. I'm telling you about this because unfortunately women have been neglected in the research. There's a study that showed that research that's been conducted in women seems to be more impactful than research published in men. But in fact, it's harder to publish this research. Reviewers who review papers for their journals are twice as likely to recommend publication for research conducted in men as opposed to women, even when you conduct exactly the same research in women. So women are neglected in psychiatry and across the board and across the field, actually, in medicine. I'm now moving over to pregnancy because that's the second time postnatally after you give birth that your estrogen plummets. So our study of those 209 women looked at postpartum depressive episodes, and it's important to look at postpartum depression. Why? Because it has both physical and psychological symptoms. It can last for months and be really disabling. It can be potentially fatal, actually. These women have feelings of sadness, worthlessness, and guilt. And the pathophysiology is multifactorial. So it's not just one thing that causes it, but it seems to be related to the signaling of a neurotransmitter called GABA, which is the calming neurotransmitter. Estrogen is also involved. So in our study, the majority of women with ADHD had an indication of postpartum depression. The majority, more than 50%, compared to 13 to 19% of women in the general population. So when a woman with ADHD becomes pregnant, it raises certain issues. She has to decide, am I keeping on with this medication or not? And second of all, she has to be carefully followed up after she gives birth, and one has to make sure that she doesn't get a postpartum depressive episode. So in the general population, it's 20%, but in ADHD, 57% of women had postpartum depression. And it seems to be related to a breakdown product of of progesterone called allopregnanolone, which influences the GABA receptor. And in fact, in the last year, there's been a treatment for postnatal depression which influences and promotes action at this GABA receptor. GABA is involved in being calm, less anxious. Finally, we looked at the perimenopause. So what happens to these women, the 209 women, the older women, what happened to them as they hit the perimenopause years? Now, perimenopause is a period of transition before the onset of menopause, where your hormone levels, particularly estrogen and progesterone, also testosterone, decrease progressively. Okay, so if you have questions, please post them because we're going to be finishing in the next 5 to 10 minutes, and I can then answer your questions online. All right, so what is menopause? It's an interesting definition. It means you haven't menstruated for the last year. But how do you know that? Well, you only know that retrospectively. When you've had no menstrual period for the last year, then you know you're in menopause. As I've said to you already, it's the age of onset is around 51 years on average. Of course, there's some complications. For example, women who are on who have an intrauterine device like the Mirena loop, often they go for months and months without menstruating, so it doesn't mean necessarily that they are in menopause. Essentially, it's related to a decrease in function of your ovaries, and therefore your hormone levels drop, particularly estrogen. And it can last 2 to 10 years. So it's not a couple of months. Some women have very mild symptoms, but about 30% of women have severe symptoms. So not surprisingly, we found that in this group of women, there was an increase in perimenopausal symptoms in the women with ADHD. They had 3 times more depression and anxiety around the perimenopause. They had hot flushes and heart palpitations and night sweats, what we call the vasomotor symptoms, but they also had sexual symptoms, genitourinary symptoms, dry vagina, pain during sex, bladder that doesn't seem to hold much urine and running to the toilet, more urinary tract infections. So they had all of those more than in the general population. Now, as I said to you, for about 30%, the symptoms of perimenopause are really severe and problematic. 1/5 of women are lucky, they seem to have no symptoms, and for about half, they are mild. But when you're in the perimenopause, you have an increased chance of having a depressive episode. And the symptoms related to estrogen seem to cause worse sleep, worse concentration, and palpitations. Now let's look at what happens to a woman from the age of 40 when she's approaching menopause. If we look at the onset of mood swings and lack of concentration, we see that starts at around the age of 45 or 50 for women. And those are very similar to the symptoms that women get when they're diagnosed with ADHD. So they co-occur. And in fact, interestingly, many women are diagnosed late with their ADHD, and often it coincides with the onset of the perimenopause. I want to just stress to you that PMS, premenstrual symptoms, and perimenopausal symptoms can coexist. They're not separate. And already I mentioned once, but I'll say it again, women who have premenstrual dysphoric disorder symptoms are more likely to have a worse time in the perimenopause. It might reflect an underlying sensitivity to the hormones. So premenstrual syndrome is linked to more severe hot flushes during the menopause. People with PMDD are twice as likely to have an early menopause before the age of 45. In general, women with ADHD have an earlier onset of menopause, and 68% of them have severe hot flushes, heart pounding, palpitations, so what we call the vasomotor symptoms. So we believe, how do we explain this? And this is how I'm going to end my talk in the next couple of minutes. Times of low estrogen have impact on dopamine, and dopamine neurotransmission is less effective because at these 3 periods in a woman's life, when estrogen is low, dopamine is also low. And this has been described since 1995, the interaction between ADHD and hormones, but it's been studied only recently. There was one case report that ADHD symptoms get worse in the week before menstruation, and they seem to get better during pregnancy when the hormone levels of estrogen and progesterone go much, much, much higher, but then they plummet after you give birth. Now, why is estrogen so important? Both estrogen and progesterone affect several neurotransmitters. And in fact, you can consider the reproductive hormones as neurotransmitters themselves. They have impact on the brain. They influence serotonin, which is related to mood and anxiety. They influence dopamine, which is related to movement and concentration and focus and impulsivity, substance abuse seeking behavior, and they influence glutamate, which is a neurotransmitter involved in excitation. So they have massive impact on cognition, thinking, and mood. Now, interestingly, estrogen is not only produced in the ovary, it's actually produced in many places in the body, in the liver, in the fat, in the heart, and in the brain. So we've got to consider these sex hormones as neurotransmitters themselves, and there are interactions between dopamine and these hormones. Estrogen and progesterone help the growth of nerve pathways, they help nerve cells communicate, they have a direct effect on thinking, emotional response, memory, learning, motivation, being impulsive, and decision making. And all of those that I've described are very, very common in women with ADHD. So estrogen stimulates the production of dopamine and it stops it being broken down. It directly stimulates the receptors. It acts in areas of the brain that are involved in emotions and motivation. Estrogen impacts working memory through its action on dopamine, and it protects our bodies against inflammation and stress. One of the symptoms of perimenopause is a frozen shoulder or increased pain in the joints, and that's because estrogen is protective against inflammation. Progesterone itself acts via estrogen. So these two factors, low dopamine, low estrogen, reinforce each other mutually and have an effect on severity of ADHD and severity of mood symptoms. It's important to look at this because ADHD in women is different in terms of its presentation and how we manage it. And all the treatments we use were in fact modeled and tested on boys. Until 1993, women were excluded from all pharmacological research in the US. Since 2016, we have to use female mice in research, but unfortunately, even today, men predominate in published studies because it's harder to publish research on women. So the medications seem to work differently in men, and women. So women tend to get more side effects, 1.5 times as many. This picture shows you that women in many organ systems, when they're given, for example, anti-diabetic medication, they have more side effects. So my last slide is let's not miss ADHD in women. Let's avoid misdiagnosing these women, missing the diagnosis and considering ADHD in women as some kind of mystery. Let's take these fluctuations in hormones and mood into account. I've mentioned to you that we're producing a new diva, which is more sensitive to women and their hormones. Sandra Coy, and a cardiologist and a gynecologist, have launched the Head Heart Hormones Network. You can look it up online. It's also translated into English, gives a lot of information on ADHD, heart problems, and hormonal problems. And I'd love to hear your questions. Thank you so much for your concentration and your attention. Thank you very much to ADHD Europe for everything you do. That's our research team a couple of months ago. It's now got much bigger. Let me hear from you. What are your questions? You can look at the website to look at more studies on ADHD. So do people have experiences they want to share or questions they want to post on the chat? We still have 10 minutes, so we have some time. What steps can a woman with ADHD especially make in order to prevent postpartum depression? Well, I think the first step is to be aware that it could occur. The second step is to manage your pregnancy as well as you can by exercising, trying to get enough sunlight in the morning and good quality sleep at night, eating a healthy diet, getting support from loved ones. If you don't have many loved ones, trying to create a circle of people around you, and then alerting your midwife or your gynecologist that you are at higher risk for postnatal depression and that they keep a very close eye on you after you give birth. And then not wait until the symptoms get shocking and terrible, but act early. There's some very good treatments for postnatal depression. What do you think about the idea that girls and women are less hyperactive than boys because they hide it? Is it perhaps a gender bias? So yes, I think that that's a good question. Women do experience hyperactivity, but they experience it internally. So it's not often this moving around necessarily physical hyperactivity. It's more internalized. So they feel restless inside. They feel their thoughts are rushing. They feel they can't unwind. They feel sometimes a little bit anxious or panicky. There have been different responses to different research on this question of hyperactivity. Some girls with ADHD are in fact hyperactive physically, and often they are tomboys, and it's attributed to the fact that, they're just acting more like boys, but in fact it's related to an underlying ADHD. Historically, girls and women haven't been spoiled by the various interpretations of their potential hyperactivity. Okay, so this is absolutely right. There has been a huge amount of bias in treating women with so-called psychiatric problems throughout the ages. Women have been seen as the other. Women have been diagnosed and treated predominantly by men who have interpreted their symptoms the way they saw fit. Hundreds of years ago, it was believed that women's uterus would wander throughout their lives and throughout the cycle through their body, and that gave rise to all their alleged problems. And that's where the word hysteria comes from. Hysteria was related to a wandering uterus, which we know is not true at all. So women have been accused of being hysterical, accused of having, making things up or being overly emotional, and it's often been through the gaze of the male doctor. Okay, recent research shows that ADHD can manage itself in just as diverse ways in girls as in boys. Hyperactivity can be just as present. So I'm going to sort of jump the gun here a little bit and tell you that we've just looked at 2,000 women in PsyQ where I work, and we've looked at how they answer the DIVA questionnaire, and we found that you're absolutely right. More recent research shows that women and girls are, in fact, more as hyperactive as boys, especially if you look at the internal hyperactivity. Okay, myself and my 2 children, teenage daughters of ADHD, my 12-year-old daughter is struggling, and I think she could have PMDD. What would be the way forward? Well, Elvance 30 is her treatment. One could increase that dosage to maybe 40 in consultation with a healthcare provider. If her PMDD symptoms are serious, first it's got to be diagnosed. To diagnose it, you need at least 2 months of filling in a menstrual cycle calendar so that you can actually make sure that those symptoms are worsening before the period. And then it would be a choice. Do you start by increasing the ADHD medication, or do you start on one of the other treatments like an SSRI? I'll just say something quickly about SSRIs in PMDD. They seem to work completely differently to how they work in depression. For all of you who've been on an SSRI with depression, you know that it can take up to 6 weeks to have a good effect from a dosage of an SSRI. In PMDD, the medication seems to work within hours. There are 2 ways to give an SSRI in PMDD. The one is just cyclically, just in the week or 2 before the period, and then stop, or you can give it continuously. Okay, so are there misdiagnoses between ADHD and burnout? Absolutely. So burnout is a kind of complicated term, but what we know is that women with ADHD tend to overburden themselves. They often have what we call role strain, which means they have many roles, many more than men. They have to work, they have to run a household, they have to look after children, they have to look after sick relatives, they have looking after their friends. So because of role strain, women have an increased burden. They're more stressed, and therefore they can perhaps have burnout. They also have more chronic fatigue syndrome. That's been shown if they have ADHD. Okay, is endometriosis, Liz asks, is that impacting? There does seem to be an increased prevalence of endometriosis, and endometriosis means that you have excessive growth of that uterine lining, not just in the uterus, but in other parts of the body. You can have bleeding into other parts of the body. It's an extremely painful condition. You can get cysts, and it needs to be recognized. Madeleine. I'm 43, I take lisdexamfetamine and sertraline. I tried HRT, hormone replacement therapy, as my ADHD symptoms massively worsened in the last couple of years, but I didn't find it useful. What are the other options? Okay, look, I can't give individual medical advice, but I haven't really spoken about hormone replacement therapy. And it does definitely have a role. There's been a lot of panic about HRT because people believed from a study in 91 that it increased the chance of breast cancer. That has been disproven. If you're a healthy woman and you don't have various sort of risk factors, you can take hormone replacement therapy. Many of the hormones we use today are bio-identical, meaning that they are similar to the ones that you have in your body. And you can also take them at low doses, but maybe what happened there was the dose was not high enough. So I would discuss it with a menopause consultant and maybe give it another try. and make sure that the HRT dosage was adequate. Otherwise, yeah, maybe one could increase the dose of the sertraline. Okay, so I see a message from Chantal that we will deep dive into these questions in the panel discussion in December. We'll hear the voices of all. Are there any last questions? We have a couple of minutes. I'm happy to take them. You've been amazing. You've kept me on my toes. Sorry, she meant to say October. Okay. Not October, of course, is ADHD Awareness Month. So it's really nice that ADHD Europe is planning all of these activities. I was just about to say that you've been an amazing audience. You've asked me a lot of questions. You obviously have a lot of knowledge yourselves, and that's very exciting. There's another group called Cycle Care for women. You can maybe look that up online and put it on the screen. Cycle Care is in Dutch and in English. It's got a lot of information on the menstrual cycle and on hormones in general. And the H3 network I mentioned before. I'm seeing some thank yous coming onto the screen, which is always lovely to see. Thank you so much for your comments and for your answers. And I see someone, je peux voir que vous écrivez en français. I see that we spread across the world. There are people in Greece. Lovely to see someone from Poland. I've been to Poland before, and it's always nice to connect up with friends and with colleagues. Thank you for all of your comments, and stay tuned to what ADHD Europe is up to in October. It is the awareness month. You'll be coming across all sorts of stimulating, scientific, and supportive information for you. Finally, I'd like to thank the organization of ADHD Europe for helping me with this webinar. Okay, so please share our webinar.